What do we got?
Root canal, and by the looks of those x-rays, it's not going to be pretty.
Hello everyone, welcome to Professional Patient. My name is Schnuerchen. First, the disclaimer. I am not a doctor or a psychologist or any kind of mental health specialist. I am just a patient. Today I want to talk about dentist appointments. Those are a big problem for a lot of people, including me. Dentists are these people who earn their yachts and golf club memberships from other people's pain and misery. Must be a fantastic job. First, a little cautionary tale that really happened to me. In the past, I used to skip appointments. I was so scared of going to the dentist that I completely ignored the possible consequences, and I paid for that with a lot of pain. A tooth got infected, and even when the pain started, I still chose to ignore it. I took painkillers and pretended nothing was wrong. Then at some point the infection became so bad that half of my face hurt. My ear, it went all the way into my neck and shoulder. Every movement hurt. I could hardly turn my head anymore. That was when I had no choice anymore. I had to go because I really needed help.
Help! You need help!
And the worst of all was, and it served me right, the infection was so advanced that the tooth could not be sedated anymore with an injection. So I had two options. Having a short narcosis. That was out of the question. I would not let anyone work on me while I was asleep. It's not going to happen.
I absolutely refuse.
Or pulling the tooth without any kind of anesthesia. I chose that, and believe me, that is still in the top 3 most painful events of my life. That's why not going to a checkup is no longer an option. That was years ago, and I have learned that lesson. I have made some progress here. I don't immediately panic anymore, but it still drives my pulse up. So, as someone scared of dentists, there are 2 major problems: making an appointment and going to one. First, making one. I know how hard, maybe next to impossible, it can be to pick up the phone and make the call to get an appointment. There are several ways to make this easier. One option, if you absolutely cannot do it yourself, ask someone else to call for you. You could ask a friend. Give your friend a list with dates and times and let them call. If you have a complicated calendar, you could stay in the room and nod or shake your head when asked if a certain date is good. If you don't have a friend you could also ask your therapist to help you with that, or your regular doctor. I'm sure in most cases a doctor will understand. With your therapist by your side, you might even be able to make the call by yourself, or with a friend holding your hand. Maybe you have a friend who also needs an appointment and you can both make the call together, helping each other. That might already make a huge difference. If you want to call yourself, write a note for yourself with text, some kind of script for the call. It's sometimes hard to remember what you wanted to say when you're in a stressful situation. Another idea might be that you tell the person you're talking to on the phone the problem. Usually the assistant of the dentist or someone like that. Tell them how difficult this is for you. Dentists are usually used to that kind of thing, and the personnel working for them too. It can make a huge difference when the person you're talking to knows that this is really difficult for you, and if it's only so you know they will understand when your voice sounds shaky. So when you successfully made an appointment, at some point you will actually have to go. And these little jerks usually don't just sneak up on you. No, they announce themselves in advance. And make you nervous. From my experience, it is a good idea to make an appointment not on a Monday. That way you will completely ruin the weekend. But making it a Thursday is also a bad idea. Because then when the week started, you still have days to wait. I personally, when something scary happens during the week, I want it to be over. Tuesdays or Wednesdays are ideal in my experience. Not immediately on Monday, but also not too far into the week. Fridays are unacceptable. Nothing should ever spoil a Friday. So, the day has finally arrived. Get up in time, leave rather a bit early. The last thing you need is more stress because you might be late. It is okay to let the people there see how nervous you are. They are professionals, they understand. And if they don't, they have the wrong job, and that is not your fault. There is something a therapist once told me about. He used to help patients with dentist issues. For me personally, that is not helpful, but maybe it is for you. He used to call the local dentist and ask if he could just come together with a patient and sit in the waiting room for a few minutes, just to get used to it. As I said, that is not for me, but he had patients that found this really useful. This is the next thing. Sitting in the waiting room for too long doesn't help either. So when you're early, rather wait outside, take a short walk to calm down. Only go in like 5 minutes before your appointment. It can help to have something with you can hold in your hand when you're sitting in the chair. Maybe a stone. I have a small stone I really like. It's small and very smooth. It feels good in the hand. A small stuffed toy or something similar might also help. It might be that your doctor offers you something to calm you down a little, something like Valium when your anxiety gets too bad. Maybe you can even ask for that.
You could have just asked.
So you should not come by car in case you want that, because when you took Valium, you can't drive anymore. Generally a good idea not to drive when you're anxious in general. But of course not everyone is so lucky to have a dentist in walking distance. So when you're in the chair, if you can, close your eyes. Seeing every movement around your head can make you even more nervous. If you're able to, go to a nice place in your head. Imagine you're, I don't know, on a beach or in the woods or something. That is something I usually do when I'm in a stressful situation and I need to distract myself from what's happening. And it helps me a lot. So sometimes it also helps me to make small movements with my hands, like, for example, pressing fingertips together, like this. I tense my hands by pressing them together and then try to let go again. You can try to concentrate on that rather than what's going on in your mouth. And never be too proud to ask for a tooth to be sedated in case you have a cavity. I told my dentist no matter how small the cavity is, I always want the tooth to be sedated. And the most important thing, never ever leave without a new appointment in your pocket. Yeah, so this were my thoughts on how to deal with dentists. I hope there was something useful for you somewhere in there. In my next video, I will probably not talk about just one certain topic. Since my depression is getting worse, I will talk about a couple of things I'm trying at the moment to try and deal with that. So I hope I see you then. Have a nice day and goodbye.